Hello and welcome to Coffee and Conversation. I'm your host, Shashank Bengali. Today we're being joined by Seth Schoen. He's the Senior Staff Technologist at the Electronic Frontier Foundation, which is a nonprofit that defends civil liberties in the digital world. Seth, thanks for being with us.
Thanks for having me.
So, Seth, we're in the middle of this global pandemic. It's an unprecedented time for most of us, and we're seeing governments across the world really stepping up their efforts to track citizen movement in so many ways. To start off with, tell us why this is happening and how are these tracking efforts helpful in a public health crisis?
So we've heard all sorts of reasons why governments would like to know more about populations and about people's whereabouts during the crisis. I would say one of those is quarantine enforcement or enforcement of stay-at-home orders or shelter-in-place orders. In a number of countries, when a traveler arrives, the traveler may be told to stay at home for a period of time, and some governments are very interested in trying to check that people comply with that kind of order. We've heard about governments trying to get general statistical data about, for example, how crowded particular regions are. Governments might be interested in gathering data that say, well, there's a higher risk in this part of the country. And then the last one has probably received the most attention, which is contact tracing. The government, or we, the public, or we, the medical profession, some form of we, would like to know more about exactly which people have been close in proximity with one another, so that if it turns out that one person has been infected, there may be an opportunity to contact other people who were nearby that person.
And can you talk us through some of the technologies that are being used, some of the apps, for example? We've seen apps that help with contact tracing. We've seen wearable devices become one thing that people have used. What sorts of technologies, what sorts of devices are being used to achieve some of these goals you're talking about?
It's really a fast-moving area, and we had a joke. People are trying to track COVID, and then there are people at different universities, for example, different NGOs, who are trying to track COVID responses. And just the number of projects that are trying to track responses has grown so large that we've actually seen a couple of universities trying to now track projects that try to track COVID responses. We've seen, again, some things that are really more about monitoring individuals, and that's very commonly individuals who've arrived from overseas. In South Korea, if people return to South Korea from overseas, they're told, you must stay at home for 14 days. In that case, the government is really interested in using people's mobile phones to enforce that. And they have subsequently also experimented with other kinds of wearables, such as bracelets that have either a printed barcode or a wireless barcode that the phone would be able to scan, and then the health officials would require the individual subject to the quarantine to scan the bracelet.
Here in Singapore, it's quite common that, and also in South Korea, scanning a QR code when you enter a crowded supermarket, or installing an app, for example, that tells you if you're going to perhaps come into proximity with somebody who is a known infected case. Are there examples elsewhere where this sort of passive monitoring is being done on the general population?
We have heard about many projects to do this kind of exposure notification. And there are several different models. There are a number of different projects. I suppose it's been very chaotic. There's been a lot of controversy about the different privacy models, and I know a frustration, certainly for Europeans, is that the apps are often developed and deployed at a national level. In Europe, where people have become more accustomed to have a lot of international mobility, they don't necessarily have a way to share that information internationally. Even if a government wanted to say that it should be legally mandatory for the whole population to use a certain app, it's just implausible to get everyone to comply if not everyone even has a device that's capable of running the app. That's a challenge. Apart from privacy concerns, there is this very practical issue that not everyone has or carries a device that would be capable of using any particular app.
All of us are increasingly accustomed now to signing over a lot of our location data, our personal data to social media apps to be as safe as possible. But there are some really serious privacy concerns, and I want to know how EFF would encourage people to think about this trade-off, to the extent there is a trade-off, between public health and privacy.
In South Korea, for example, the government already had in place a law that dated apparently to the SARS epidemic that gave the government a lot of emergency powers specifically related to responding to a pandemic like this. Not just some sort of general emergency law, but actually a law about epidemic outbreaks, tracking of the population in response to an epidemic. There's still pretty substantial public support for what we might sometimes see as pretty intrusive monitoring of the population. For example, there was a research paper that was published, and it talked about different dynamics affecting the spread and about a particular cluster of cases, and the researchers just casually mentioned that they found out about the location data that they used in investigating those dynamics in South Korea by monitoring the location of people's cell phones. Not every society would think, oh, obviously, the government and the researchers should just be able to know where everyone is. I think most people would think citizens ought to be cooperative with fighting the outbreak, but that might be a different matter. For the duration of the crisis, the government should be given direct access to know everyone's location at all times. And again, I feel like we have heard different things to some extent in Latin America, to some extent in the United States. Certainly compared to Singapore, I think people here in the US and people in Latin America often have a lot less trust in the state. Both in terms of the state's good intentions and in terms of the state's capacity or capability to respond effectively. We definitely want to emphasize that location data is very, very sensitive, that it's really very revealing. It's one of the kinds of data whose sensitivity we think is so easy to underestimate because, for example, it tends to reveal things that people don't even realize that it would reveal. A classic example is people's relationships. Whether that's family relationships or professional relationships, the fact that particular people got together may be sensitive information. Location information also tends to reveal people's religion because it will reveal where and when and how often they go to religious services. It may reveal their health problems because they may go to a specialized kind of clinic or healthcare facility. There are all sorts of inferences that can be made potentially that are really very sensitive.
Is there a way that we should be thinking about restrictions on the types of data we're allowing governments to use about us? So should the data that's collected be time limited? In the case of Singapore, they're talking about using data that is collected by Bluetooth signal and not by cell phone towers. It's a question of logging your proximity, but not your exact location. Are there fences we can think about advocating that be put around our data so that it cannot be exploited in the way you're describing?
I think all of the things that you just mentioned are great suggestions. Purpose limitations, time limitations, limitations on which government entities can access things. I think one of the big concerns in a number of places has been, people might actually be relatively happy to have some of their contact information during an emergency be in the possession of certain health authorities, but they wouldn't necessarily want that same information to be shared with other parts of government. If they don't have reason to believe that the government is able to really limit the uses of that, they may be much less willing to cooperate with the collection of that information. And I think that's a pattern that we see all the time with medical and population surveys and data collection, that the confidentiality between a patient and a physician is really essential in allowing the patient to really be forthcoming. If a patient reveals some kind of misdeed or some kind of illegal activity, it's really important that the physician can actually keep that confidential so that the patient will have a real, full, honest conversation about it with the doctor. And obviously that concern also will vary from country to country, because there are some countries where there's quite a history of this kind of leak or this kind of abuse, where people might say, 5 years ago we had a scandal where this authority couldn't keep control of its data, so how do we know that that won't happen again if we give them sensitive information about whether we've been infected with COVID-19.
We've really appreciated all your insights, Seth, and thank you so much for your time. It's all the time we have for this episode of Coffee and Conversation. I'm Shashank Bengali. Please join us next time.